Hi there, welcome back to A New Way to Age. This is the second show in a 6-part mini-series. Today is an exciting show. We're actually going to see a live pellet insertion of the bioidentical hormone treatment. I'm here today again with Dr. Walter.
Hello.
And Dr. Walter, I just wanted to go over a little bit. On the last show, we talked a lot about basically everything to do with bioidentical hormones. So today, as I said, we're going to be seeing a patient, a live demonstration. Can you lead us through the start to finish of what's going to be happening today?
Yeah, so today it's really a straightforward procedure. We're going to get the patient on the bed. I'm going to clean off the skin, numb her up, get everything set up there, and then once her skin's all numb, make a little incision, put the pellets in, and get her taped up. It's really not a major procedure. It's certainly not major surgery. And then during the procedure, I'll talk a little bit about what we do and how we get people introduced to this. One of the things I wanted to show you is we have books available here. This is Dr. Donovitz, and it's Age Healthier and Live Happier, and he really does a wonderful job. He's actually the developer of BioT. He's a board-certified OBGYN doctor who years ago started with many, many patients. I believe he had about 10,000 patients at one time between his different offices, and obviously had people helping him. But he really does a wonderful job explaining what bioidentical hormones are, what the different hormones do, the testosterone, the estrogen, the thyroid, and it's an easy read, but it really has some science backing behind it. So it's really, for people who are interested in this, that might be one to pick up. It's by Dr. again, Gert Donovitz. Age Healthier, Live Happier. You can get it on Amazon, and we have them here in the office also.
So great. So I just wanted to recap. So today, our patient's name is Terry. Can't forget that since my name is Terry. But Terry's been doing the hormones for quite a while now. Mm-hmm. When you're a new patient, there's a way to go about getting an appointment.
Yeah, so obviously, some people come to us and they've been looking with Dr. Google for years and they know all about this. But most people don't know that. So the first thing we usually do is recommend a consult. They would sit down usually with myself, and go over the entire program, and we have some slides and pictures and to show them to kind of make it easier to understand, and go over everything, excuse me, from A to Z. Then if they decide they want to do it, they would get a set of lab tests. They could just go through their own doctor or insurance, or we could draw the bloods here. And we use both the information on their hormone health history as well as the lab tests to come up with a sort of a game plan, a master plan of what we're going to do, how much testosterone, how much estrogen, how much thyroid hormone, other supplements. There's a few supplements that we recommend that fits along with this. And then then we would then sit down, go over that with them. I give copies of their lab tests, but I spend time just explaining all the different labs to them. And some of them they may be familiar with through their regular doctor's office, but there's some more specific ones for the different hormones that I go over. And it just kind of explains them what it is that we do and why we do it. And then maybe the same visitor, if they want to come back a second day, then we actually put the pellets in. We'll do blood testing again for women in 6 weeks. I sit down with them in 7 weeks just to make sure everything's going well. If there's some adjustment needed, it can be done at that time, or even over the phone before or after that if needed. But typically, once people have a good level of hormones and they're at steady state, then for women it's every 2.5 to 4 months coming back and getting pellets reinserted. So it's 3 or 4 times a year. And they just kind of forget about it but feel like they used to and feel better and just feel rejuvenated again.
Good, very good. And so the demonstration that we're going to have today, the pelleting procedure, it's the same for men as it is women. We just happen to have a woman today.
That's correct. It's the procedure is the same. The men get it less often and they get more pellets put in. So they usually come twice a year. But and we would not give estrogen to men, but thyroid and testosterone. So it basically is the same procedure. Maybe take a couple minutes longer, but it's the same process.
So now we're actually going to go with Dr. Walter and our wonderful patient, Teresa, into the treatment room to watch the actual procedure.
This is Terry. She's had pellet insertions a number of different times here, and she obviously comes back because she really likes it. You can see her testimonial on our website, and she can talk afterwards about what her experience is, just kind of recap it again. So what I'm going to do is put the pellets here, and it usually goes in the upper butt cheek, so she does not have to get undressed for this. I'm just going to pull this down a little bit so I can get into the area that I need to work in, and we're just going to kind of put them up here because most people have enough padding on their butt. I'm going to grab some gloves here. the first step is to get her numbed up, and she can tell you that this is maybe feels like a mosquito bite. It's not any more uncomfortable than that usually, but that makes the rest of the procedure possible because it gets the area numb here. Use a little bit of lidocaine, numbing stuff, same stuff the dentist uses, and just gonna clean off the skin here a little bit. All right, so a little bit of a pinch here. 1, 2, 3. And this is just to kind of numb up the skin and where the pellets are gonna go. You feeling anything here? Maybe a little tiny pinch in the beginning?
Not much.
And then again, you've had the pellets before, so once the pellets go in, you don't usually feel anything there. Just numb up the entire area just in case the pellets, sometimes they'll slip a little bit sideways there. Okay, so that part's done. And then I'm going to get everything ready. It's going to take a couple minutes for the pellets, for the area that's to get fully numb there, and I'm going to get set up in the meantime. All right, then get the pellets here, and we have 6 different sizes of pellets. And for her, we found a good balance for her. We just had a discussion a few minutes ago about whether we want to increase a little bit, and she's very happy and with the results that she has, where she's had it now for a couple of years, and we're just going to continue that. So there's 1 different estrogen pellet here, 2 different testosterone pellets, just to get to the size that we want. They all come individually sterilized. Show you what the pellets look like here in just a moment. And we do a lot of it. This is just from the last couple of weeks here. All the little bottles from the pellets here. All right, now I'm going to clean off the area with antiseptic. Now, do you feel anything pokey here?
A tad bit
Okay,
of pressure.
do just wait a little bit longer. Let me show you people what the pellets look like here. So this container shows the pellets. I don't know if you can see that in there. You able to see them? I don't want to spill them on the floor. There's 3 different pellets in there. One is the smallest one is estrogen. That tiny one is that right here. That's enough estrogen for a woman for 3 to 4 months. The other 2 pellets, this is a bigger testosterone, and then that's a smaller one to give her the total of what she needs. These just all go in, put in together. You'll see that in just a moment here. All right, ma'am, how about now? Anything pokey? Nothing?
Much.
All right. Gonna poke there, and so it's just a little incision. Slip behind you here. And sometimes a little bit of bleeding if there's a small blood vessel or something hit. Have a special introducer device here that's in there now. Now just take and stack the different pellets right in a row. That's the 2 testosterones. Little estrogen there. And that just gets put up inside. And it probably goes maybe 1.5 inches under the skin. The pellet insertion's all done. You see that was quite quick and easy, or she can tell you too. And now what I'm going to do is just clean everything off, and then we'll put some tape over it, and then some gauze, and then we'll be all done here. Now, the pellets that I put in there are bioidentical hormones. We talked about that in the last video, but this is really a critical point. There's lots of different hormones out there, but many of them that physicians and patients are used to are synthetic hormones, birth control pills, Premarin, Prempro. That means they're different than what's in the body. These are purely bioidentical. That means if we look at the molecule, the estrogen, the testosterone that I gave Terry is exactly the same thing that I have in me that's in the pellets. The only thing that's in the pellets are stearic acid and the actual hormone itself. Stearic acid is, people have that in their body, and if you ever have had Tylenol or Advil, it's what holds the shape of the tablet or the itself, or the pill. So it's not something that is unique, and people don't have allergic reactions or anything to it. So just going to close this up. A couple of steri strips across there to hold the incision closed. And these stay on for 3 days. Then over that, sometimes if there's a little bit of bleeding, just in case, we put a touch of gauze over there. It's a very small amount, and if there's any bleeding, then it will it'll get absorbed by the gauze here. And there's a clear plastic film called Tegaderm. It's a medical dressing. Makes a clear film right over it, and she can shower with this, and in 3 days just kind of peel it off. And then afterwards, if need be, a Band-Aid, but most people don't put Band-Aids on because it just stays closed by that time. There's no stitches, there's no glue, nothing else. Pellets are in, she's all set. I don't know if you want to if you want to roll over a little bit, just kind of show. So that's what it looks like there. So you see the gauze in there and the clear plastic dressing on it. This is going to get washed and sterilized for the next use, and the pellets are all set there. Now, the other thing that we talk about in the consults is side effects. There are very few side effects. You can make yourself comfortable again. Thank you. You can actually pull that up if you want. You're all set. There are very few side effects, and the side effects that typically happen are temporary, or they're very short term. If somebody, thank you very much, if somebody has really low hormones as their body's getting used to it, then occasionally there can be some bloating, and that is temporary. People don't like it, especially thin women don't like that. It usually lasts for a month or two. It's just water weight, and it usually sits right in here. Clearly not everybody gets it, but many do, and it's if it really drives people crazy, you can give them a diuretic. That's probably the most common thing. There's some other ones other things that can happen. Sometimes it can be a little bit of breast tenderness, and that usually lasts for a couple of weeks. Sometimes emotional changes. Again, on the discharge instructions, there's some things you can get over the counter that just help with that. But it's only during the beginning of the first pellet insertion. It's not every time. What we're really doing is getting the hormones from here, very low, back up higher to where they used to be, and kind of maintaining them up there. So it's not every 3 months you're going through the side effects here. That doesn't happen. If a woman has just hit menopause and had periods recently, we make some adjustments because they sometimes you can start bleeding again, and most women don't like that, but there's some easy adjustments to make to control that. So there's a few other side effects that are more rare, and we discuss that in the consult. And obviously, if something happens, people can call me anytime and ask questions there.
Hi there. So this is Terry, and this is Teresa, who just had her pellet therapy treatment. So I'm going to ask her just a couple questions. So Terry, how did that feel? Was it painful at all? Is it something that you would recommend to other people, that it doesn't hurt?
It's basically a little pressure. It's like if you just, when you go to the dentist and they press on your gums, same thing on your tissue, same. No pain. It's so quick.
Right.
I'm over 2 years. It was 2 years in September.
Okay.
So I've never had any problems. I've never even had any side effects. Some people do. I've not. I've been fortunate.
Good for you.
I've been blessed by this wonderful procedure.
Oh, that's wonderful. And so you said you've been doing it about 2 years.
2 years in September.
And you're going to continue to do it
Of
because
course.
you just feel so wonderful with the pellet therapy
I will
treatment.
never give it up because I don't ever want to go back to feeling less than perfect like I feel now.
And Dr. Walter is obviously very good at what he does and explains, and that, I'm sure, has helped you throughout the process, knowing how things are working in your system. And obviously, if you had any questions, he's right there to answer anything for you.
And I have asked a lot of questions.
Okay.
And he's always been there, and I make a call. He'll return my call. He's very open to talk about a lot of different things, how they're all connected. No, I think he's wonderful.
Wonderful.
Yes.
Great. Well, thank you very much for being our live model today.
My pleasure.
So remember, you can watch the episodes on ActonTV.org if you missed it or you want to go back. And also, we also have Facebook Lived the shows as well. Thank you so much.